And I would like to introduce our speaker. Dr. Nichols earned his medical degree from West Virginia University School of Medicine in Morgantown, West Virginia. He also completed his internship and residency in otolaryngology, head and neck surgery there. He has special training in allergy, laser, and eustachian tube balloon procedures. So I will turn it over to you, Dr. Nichols.
Wonderful. Thank you, Christy, and welcome everyone to our core lecture series by Zoom. Welcome you from beautiful South Hill, Virginia, where it is 64 and sunny, and all the trees are starting to bloom, and all the pollen is starting to come out. And so this is a very timely topic of discussion. Today, we're going to get into a discussion about seasonal allergies and how you can differentiate between allergy symptoms and those of sinusitis. So let's jump right in today. First, I wanted to begin talking about, why this is so important, and beyond how it impacts each individual. Seasonal allergies is one of the most common disorders that we diagnose as physicians. The last data released by the CDC indicates that 19 million adults are diagnosed with seasonal allergies or hay fever every year. It's also very common in children. Children manifest a little bit differently than adults. They have a lot more chest and upper respiratory symptoms compared to adults, where it's primarily more of a nasal sinus type of a presentation. We're also seeing a great increase in the diagnosis of food allergies in children. And so allergic diseases in general are getting much, much more common. 7 million visits to the primary care doctors were done for allergy last year, and that was the primary reason people were going. It's the sixth leading cause of chronic illness, and one big point is that it's very costly to the country. $18 billion were spent with treatment and diagnosis and doctor's visits and absenteeism from work, and it's all very significant. And one of the reasons is because allergy impacts so many different areas of our life. It's not just limited to the nose. As you can see, I'll use my cursor. Allergy is directly related to the development of asthma, sinus infections, skin rashes and disorders, eye symptoms, throat and voice box problems, and even ear infections can be directly related back to allergies and allergic rhinitis. And so that's, when people present to the office, the patient doesn't know really what they have. All they know is they have, like, for example, an ear infection. Well, the underlying cause could actually be allergy. And so it's important that we consider that as part of our differential, and it's one of the most common ones as well. So let's get a little bit into the kind of the lingo. So what is rhinitis? Well, basically just inflammation of the nose. And so allergic rhinitis is caused by allergy. What we're allergic to are things in our environment. Typically, the most common that you see would be pollen. That is more commonly seen with seasonal spring allergies. Other types of allergies can be more year-round allergies from dust, from dog dander or hair, as well as mold spores that get in our house and in our heating system. And that causes more year-round symptoms. So allergic rhinitis is a type of oversensitivity basically to what you're being exposed to. We call that a type 1 hypersensitivity. And we talked about it's because of allergens. Usually they're inhaled into the body. The body will then process that exposure and release histamine. And most of us have heard of histamine because we take antihistamines to treat it, which makes sense. But we're going to talk about the mechanism of how that occurs and why antihistamines are effective. The inflammation that you typically see is in the eyes and the nose, but anywhere in the upper respiratory tract, or as we mentioned previously, other parts of the body, you can see that. The best treatment, as always, is avoidance. Of course, it's not always practical to avoid things like that because you have to go outside, you have to do your gardening, you have to cut the grass. So that's why people go to medications. Of course, sometimes medications don't help that much. And so we're forced to try to alter the way our body responds to the allergen, and that's called desensitization. So type 1 hypersensitivity is mediated in our body by an antibody called IgE, and that's something that we can actually measure with a blood test. And that can tell you whether you have allergy or not. If you have an elevated level of IgE, that indicates an allergic disorder. It is also called an immediate hypersensitivity, in that when you get the exposure, you immediately feel it. So it doesn't delay for a day or 2 days. Within just minutes, you're beginning to see the symptoms. Here's an example. If you are to breathe in or inhale some type of a pollen in the air, well, the body will pick that up and will try to analyze that and to see if that is part of you or part of something foreign to yourself. And of course, we know pollen is not part of us, and so the body recognizes that as foreign. I'm going to go a little bit into the immunology, just a little bit. I don't want to lose you guys here, but the first time that you're exposed to an allergen, the body will process that and begin to produce that IgE antibody, which is specific against whatever that exposure was to. So if it's like tree pollen, you'll have an IgE level in your blood that's measurable towards tree pollen. And that's part of when we do allergy testing that is meant to pick up that level. Well, the next time that you're exposed to that tree pollen, it goes into the body, binds to the antibody, and then causes the release from what's called a mast cell, and that releases histamine. We talked about histamine as the big player as far as symptoms, and so we're going to talk a little bit about why that's the case. Histamine causes all of the little blood vessels around the area to swell, and they get leaky, and so all the soft tissue around the blood vessel will get swollen. And then there's more immune cells that begin to come to the area, thinking they're going to fight off whatever this is, this very dangerous piece of tree pollen that you inhaled. And so it has kind of a cascading effect where the response builds up steam like a snowball and gets worse and worse and worse, oftentimes until you take some type of medication to help that. So now we're going to talk about the manifestations that you see that come from that capillary swelling and release of histamine. And these are pictures of inside of somebody's nose. You may not have actually got to look inside your nose before, but this is what I see when I look into somebody's nose. On the right-hand side, you'll see this structure is called your nasal septum, which divides the nostrils in half. Here on the right part of that picture is what's called the turbinate, and that gets mistaken oftentimes for a polyp in the nose, especially during allergy season when they're swollen to the degree that this turbinate is swollen. You can see it's actually touching the septum. And what that does is it blocks up the airway and gives you congestion. You can see there's some clear mucus right here. Here's some clear mucus here. And that's an important finding because clear mucus usually indicates an allergic response. If you look on the left, you'll see kind of a different type of a picture. And you may notice this purple area right in here. Well, that's also a turbinate, similar to this one, but this is more of a chronic swelling that is seen if it's been several days since your allergy season started. And that is actually blood that is kind of making the turbinate swell, and it gives it a purple appearance. And the reason that that occurs is because there's all these little blood vessels you can see here inside the nose. And then when they swell up, well, the blood vessels, they're veins, and so they look purple. And they are in direct continuity with the veins of the eyelid. And so in association with congestion in the nose, you also get swelling of the eyes. And we call those allergic shiners because they look like somebody, you got in a fight and you have a black eye, so to speak. And you see that very commonly in children, as you can see this child right here. In addition, in children, they have kind of some unique presentations. Children tend to wipe their nose like this. Most of us would grab a tissue, but that's the way toddlers do it. They grab their hand, they wipe their nose, and then they get a little crease at the top of their nose because they continue to do that all spring. And that's called an allergic salute. And that is a special sign that we look for in children that indicates allergy. Also, eye symptoms are very common as well. We talked about dilation of blood vessels, which you can see right here. We talked about swelling of tissue, which you can see This white part, the white part of the eye called the sclera, is very swollen in this patient, and excessive tearing because the eyes are so irritated. That's also commonly seen as well. Even throat symptoms can come from allergy. And you see this redness that's noted on the side of the throat here. We call this cobblestoning. It's like little bumps across the back of the throat. And that's where the sore throat from allergy, that's where that comes from. As you can see, there's no color drainage here, so this isn't like a tonsillitis. Some people go to the doctor thinking they have a sore throat, that they've got a tonsillitis, when in fact it's just a sore throat from allergy drainage. The ear can also show some findings that are indicative of allergies as well. On the right side, you see this is a normal eardrum, and you can see it's kind of translucent, almost like wax paper. You can see the ear canal is kind of a slightly red but more pink appearance, compared to this ear where you've got, again, all these really dilated blood vessels right here. The eardrum is slightly sucked in. We call that retracted. And the color of the eardrum, I don't know if you notice, is slightly different. And that is because there's fluid behind the ear. And that's one of the things that we always think about as fluid is, well, what is going on with the nose and the sinuses, and could that be allergy related? Even the throat and the voice box can show similar findings. We talked about cobblestoning, and you'll see these bumps across the back of this throat here on the left. And that's, again, from allergy, and that causes inflammation down near the voice box and some increase in secretions and slight swelling of the vocal cords. And that's some of that hoarseness or throat symptom that comes with the allergy season as well. So patients always ask, well, how can I tell the difference between allergy and sinus infections or just a cold? And I know this is kind of a busy slide here, but I did want to kind of point out some things. With allergy, the symptoms are typically fairly short-lived depending upon the season. Colds are usually about a week. Sinus infections usually last quite longer, so 2 weeks or more, and that the lingering of the symptoms is what makes me think, okay, this is a sinus infection rather than just an allergy. With sinus infections, the drainage is usually colored, either yellow or green. People get a fever, they get dental pain, they get bad breath. And with allergy, you don't really see those things. You don't see fever, you don't see pain in the teeth generally, you don't get bad breath. Now, colds and viruses is kind of the one that's hard to pin down sometimes, because at times those symptoms can mimic a sinus infection. If you do get color drainage with a cold, it should quickly go back to clear after several days. Usually the symptoms don't last longer than about a week with a cold, and then you're feeling better. Then the other question I began recently is, well, how do I tell the difference between allergies and COVID? And that's a legitimate question. And certainly they both come with some cough and runny nose type symptoms. Of course, with COVID, you're going to see more systemic symptoms. Again, it's a virus. You're going to see usually a fever. You may have pulmonary or lung symptoms with that, problems with your stomach or your GI system, loss of taste of senses, taste and smell, which you generally do not see with allergies. But of course, as always, if you're ever in doubt and you're suspicious, you should go get tested and see your doctor. So let's transition here and let's talk a little bit about how you treat and manage seasonal allergy symptoms. And there's really basically 3 different choices. And of course, the one that everybody thinks about is medicine. You know, go to the pharmacy and there's 1,000 different choices on the shelf, and you know, it's intimidating. Which one should I choose? It's hard to even know. A lot of them have every symptom on the box that you could ever think of with allergy, and those multi-symptom formulations are maybe not the right choice for everybody, because you may not have all of those symptoms. And so we'll talk about that. One of the other options people kind of forget about is avoidance of what you're allergic to. And I put on here what's called a HEPA filter, which is something that you can use and put in your house, and it helps to kind of filter the air and reduce the load to your body of how much of this pollen you're actually breathing in. Your air conditioner does a pretty good job as well, There's special allergen filters for your heating and cooling system that you can choose that tend to help that as well. But sometimes it's just not practical to stay inside for all of allergy season. And so then you're forced to go with medications. Now, there are many people that take medications and don't really find that it helps. And so those are patients who have to think about what we call desensitization or allergy shots, which is a way of minimizing the overreaction that our body has to the things that we're allergic to. Let's talk a little bit more about medication and options that you can, of things that you can take. Of course, everybody thinks about oral antihistamines like Benadryl and Claritin. Those block the effect of the histamine in their body that we talked about. Intranasal steroids like Flonase or Nasonex, those reduce inflammation in the nose and are particularly good for congestion symptoms. You can take an oral decongestant like Sudafed. Of course, you have to present your driver's license to the pharmacist to get that, because it's now behind the counter because of the things people do with Sudafed and what they make out of it. Topical decongestants are used for only emergencies. I don't recommend those on a regular basis, but it can help if you're in a kind of a dire emergency and you just can't breathe through your nose. Kind of an older medication, mast cell stabilizers like Nasocrom, those are over the counter, used to be by prescription, and it helps to prevent allergies. So it's really something that you have to take before the exposure. And mucus thinners, of course, can reduce the thickness of the mucus and make it easier to clear. Now, these medications are by prescription only now, and so it requires a doctor's visit to get those. Topical nose sprays with antihistamines, modifiers of leukotriene, and oral steroids. And so those, if you try these other medications and it hasn't helped, well, it may be time to see the physician and have a conversation about some other options. So which medicines should I choose? Well, it depends on what your symptoms are like. So I kind of break it down into two categories myself. And if you have drippy, itchy, sneezy, runny symptoms, but you can breathe through your nose pretty good, well, then you want to try to dry up that drainage. And that's where oral antihistamines really help you. If you can take Nasocrom or a mast cell stabilizer before things start really getting bad, then that tends to reduce the severity there. And then, of course, some of the prescription medications can be helpful to help with these symptoms as well, even going up to the use of oral steroids, which your doctor may use in certain situations. Now, the other category is people that have congestion or thick mucus as their primary symptom. And those patients need to really do something to decongest the nose and to thin the mucus. So nasal irrigations, intranasal steroids, an oral decongestant, or a mucus thinner like Mucinex are very helpful. I don't usually recommend oral antihistamines because that tends to thicken the mucus and doesn't really help with congestion at all. So this kind of reiterates again, treatment for allergy, avoid it if you can, medications, rinse out the allergen, and then there's some discussion of desensitization or allergy injections to reduce your response to what you're allergic to. People always ask, which antihistamine do I choose? Well, there's a bunch of choices over the counter, and they vary in their level of potency. Just for the sake of discussion, Claritin is one of the least effective, but it's also mild and it's non-sedating. Allegra is kind of middle of the road. Zyrtec and Xyzal are cousins, and they are probably the most effective, but also do have a potential for sedating you, although not to the same degree that you'll see with Benadryl or something like that. And finally, I want to talk about, thinking about children and giving them medications. Not all of these medications are intended for children, and they need to be dosed appropriately. Over-the-counter nasal steroids have been approved for the use in children, some of them down to as young as 2 years old. You'll see that with Nasonex, which again is over-the-counter. But it's always good to talk to your physician if you have concerns or you're not sure about what dose you should use, or is this appropriate for my child. So to wrap it up, I think we're almost there. Allergy is super common, and it's on our doorstep as we speak. And the incidence of allergies on the rise, and something that we're all going to have to continue to deal with. Allergy in general is an overreaction of our immune system to something it really shouldn't be so sensitive to. And that degree of overreaction depends upon the severity of your allergy symptoms. You can diagnose allergy based upon symptoms, and you can do some specific testing on the body, either a blood test or even skin testing, to give you further information about what specifically you're allergic to. It's always best to avoid it if you can, although it may not be practical. Medication choice should be based upon the symptoms that you have. Think about, am I a drippy, itchy, sneezy person, or am I a congested person? And that will help you make a decision about what medication to choose. In general, avoiding multi-symptom medications because they're not really specific to what your symptoms are. It just covers everything. You can always considering upping the ante if the over-the-counter medications aren't working for you, going with something prescription, but of course you'll need to come see one of your medical providers to give you that prescription or to give you advice about that. And there's always the option of changing your nature, pursuing allergy injections or allergy treatment to try to reduce the production of the antibody against what you're allergic to. And that way, maybe you don't need the medications at all at that point. So I would invite you guys, if anybody has problems with their allergies and they're not really comfortable trying this at home, certainly make an appointment to come see us here at CMH. And I'm happy to see you. Just give us a call and we can make an appointment for you anytime. So I want to open the floor to some questions if anybody has those.
You can either unmute your microphone and ask, or you can type into the chat. We've got one from Deborah. How long can you take an OTC oral antihistamine? Days, weeks, months?
Yeah, so good question. An oral antihistamine is effective for just 24 hours. And so after 24 hours, it's out of your system. That's why you have to take it every day. I have patients that use those as their preferred method of treatment, and they take them every single day. Those are mainly people that have perennial or year-round allergies, like to dogs and cats and mold and things like that. But it's perfectly safe to take them all the time. You do have to be careful if you're taking an antihistamine with a decongestant, that it's not affecting your blood pressure or something like that, because that could give you some long-term problems if you take it every day. Some people do complain that they kind of lose their effectiveness over time. And so it may help to switch brands either from a Claritin to an Allegra if you do notice that happening. All right. Other questions?
We have another question in the chat from Leanne. For antihistamines, you said Claritin is one of the weakest. What about Claritin D? Is there a level of weakest, strongest decongestants you can recommend?
So, of course, when you think about the antihistamine decongestant combinations like Claritin D, yeah, they're actually two separate components, and they each have a potency. So Claritin D is not as effective as Allegra D, which is not as effective as Zyrtec D, although the decongestant dose is about the same. So you're going to get the same level of decongestant. It's just the antihistamine dosage or effectiveness is going to vary. Now, most people stick with Sudafed, although phenylephrine or PE, as they call it, is an option. Phenylephrine does not have such an effect on the blood pressure to the same degree that Sudafed does. It's also easier to get because you can't make methamphetamine out of phenylephrine. So, most people do agree, though, that Sudafed is probably a little bit more effective. And, there are pediatric versions of that, and there's adult versions of that. So the adult version of Sudafed is going to be the strongest that you can get, but also have the highest level of side effects.
And we've got one more question from
Sure.
Deborah about, can nasal spray cause rebound effects if used too long?
So it depends on which nose spray you're talking about. So the answer is nasal steroid sprays like Flonase or Nasonex does not cause rebound. It also has a gradual onset of action. So if you start using Flonase today, it takes 2 or 3 days for it to really start to kick in. Same thing with the intranasal steroids like azolastine or Astelin or Patinase. They are not addictive, so to speak. There's no rebound associated with those. And of course, that's a prescription medication that you have to see your doctor to get. Now, medications like Afrin or neosynephrine over the counter, those do show rebound. And so we do not encourage people to use those for more than 3 days, and really only in an emergency if your nose is totally stopped up.
Great. You guys have some great questions. We've got a few more minutes if anybody else wants to ask anything. If not, we will be posting this recording on Facebook and on our website under CORE. So thank you all for coming out today, and thank you, Dr. Nichols, for your help.
Thank you. Appreciate your time and everybody's attention. You guys have a wonderful day.
Bye-bye.